so much for sitting down with us and taking the time. I know it's a busy
thrilled.
day for you.
Yeah, it's an exciting day.
It is. And you've been no stranger to the Cleveland Clinic with your Alzheimer's work. But
Yes.
if you don't mind, explain what you're here today to announce.
So I partnered with the Cleveland Clinic several years ago with the Women's Alzheimer's Prevention Center in Las Vegas. And the goal there was to see, did that work? Would women be interested in the prevention model? Would they be interested in their brain health? Would they want to do what was necessary to try to prevent Alzheimer's? And over that time, I started talking to the Cleveland Clinic about we really needed a comprehensive women's health center where women of all ages could come and feel seen, feel valued, feel taken care of, that combined care and research from birth all the way up, and that women's lives were long, were extensive, and were complex. And so this Women's Comprehensive Health and Research Center is the culmination really of several years of work, but really decades of work of interest on doctors who've been interested in women's health. So today is really the Cleveland Clinic putting a flag in the ground and saying we want to be the preeminent center for women in the world. We want to take care of women. We understand that they're not just little men, that their lives, their health spans are long and complex and complicated, and this is the place to come for your brain and for your body.
And in your research, you and doctors and
Right.
some of the experts found some gaps that were really surprising in why women midlife and later were missing some of these key findings.
Well, there's huge gaps in women's health, period, end of story. The research has not been there. Women haven't been included in the same way men have been included. There's gaps in medicine we take. There's gaps in knowledge about devices for women. There's gaps all over the place, and particularly when it comes to Black and brown women. So I think that, there's also been a huge lack of attention on women at midlife. And we talk about women 40 to 60, women are taking care of parents, they're working full time, taking care of kids, and they drop off very often seeing their doctor. And then they come back in their 60s with a chronic disease or one of many chronic diseases. And so I think focusing on women at midlife, trying to understand what is going on for women at midlife, is that the place that Alzheimer's begins? Is that the place that cardiovascular deterioration begins? Is that the place that type 2 diabetes begins? And then we can help women at midlife live longer and live better, because women do, as we know, live longer, but they don't necessarily live better.
I know for you, this is a passion project. Why are you so passionate about women's health?
Well, I'm a woman, first of all, and in trying to understand Alzheimer's and why women were disproportionately impacted with Alzheimer's, I discovered, there's there hadn't been research on women, and that was a health equity issue. It was a human rights issue to me. My mother struggled her whole life, and therefore my whole life, with her health, getting misinformation, not being treated like a woman, her health not being understood, and that was a scary thing to grow up with. And I also felt that, I couldn't understand Alzheimer's in women unless we understood what was happening in women, particularly at midlife. And then to see that we didn't have the research, I was like, no, we have to rectify this. And I can use my voice and my energy and my passion to make a change that will benefit women in the future.
And just last month, you were at the White House, where the president signed executive order.
Yeah, we've been at the White House several times. I mean, this president has done an incredible job, and the First Lady, first with the White House Initiative, which was last November, and then with the executive order just last month, and then certainly galvanizing the entire federal government, allocating money, hundreds of millions of dollars, saying we needed $12 billion to rectify this situation and to really focus on all that's going on with women. So it's not just women are 2/3 of those who get Alzheimer's. There are 80% of those with autoimmune. They're the majority of those with MS, and the list really goes on. 6,000 women go into menopause every single day, and so many women go to their doctors in the perimenopause or menopause stage, and they don't get the answers they need because they don't have the research. The doctors don't have the research to really be able to tell women, well, we know this, we know that, we know you should stay on hormones this long, or we know you shouldn't go on hormones, or you should go on hormones. And so that's unfair and unjust, and we're changing that, and I'm really happy and proud to be a part of that sea change. I'm happy and proud of the women's Alzheimer's movement that's been a huge part of shifting this change. When I got involved in Alzheimer's, because my dad got Alzheimer's, women weren't even in the picture. When I would go around and talk to doctors, they would say, well, you know, it's just because women live longer that you think that there are more women with Alzheimer's. And that was wrong. And so I'm really proud of the Shriver report, which changed the narrative. It put women front and center with their issues with Alzheimer's, so it put them front and center of the disease. And I think the White House initiative is putting women front and center in their health care. So often when we talk about women's health care, we talk about reproductive health and or breast cancer. And while those are two very important aspects of women's health is so much broader, so much longer. We don't talk about endometriosis. We don't talk about osteoporosis. We don't talk about depression. We don't talk about bone health. All of these things that are really critical to how we age and how we live and how we work.
Just recently on the Today Show, and just in case anybody hasn't caught it, it was eye-opening to me how you brought up that women weren't part of some of these research projects until, was it 1993?
Yes, exactly.
That was really eye-opening.
Yes, and I think it's so interesting. I travel all over the country and I talk about that,
Yeah.
you know, that it's only until recently that women have been included in trials. It's only until recently that we've even begun to focus on women's health. It's only this president who has started a White House initiative. It's only this president who has said $12 billion needed to rectify the situation. And people are like, that's impossible. How could that be? Yeah. It is. And it is something that we can change. And so we need women to vote for people who will put money into the federal budget to study women's health. We want to get researchers to know that there is actually money now at NIH where they can go and get money for their grants, for their research, because women's health can't advance unless we have the research. Women can't live healthier lives starting at a very young age unless we have the research to help them. So whether it's in their maternal health, whether it's involving endometriosis, whether it's involving menopause, perimenopause, you name it, if we get the funds, if we're able to galvanize the research, if we're able to get the information from the research, women can make informed decisions about how to live, how to age, how to work, how to live.
And starting with this research center here,
yes,
it will have a ripple effect across this community and others for sure. As a mother and a grandmother, what do you hope for your daughters, granddaughters in the future with starting this research and really putting funding into it?
Well, to me, it's research and care, because so many women that I've spoken to over these 20-some years that I've been working in this space tell me that they have felt unseen, uncared for, invisible in the healthcare process. And I want to change that. And I think this center is a center that has the word comprehensive in its name. And we need to start looking at women's health span as a comprehensive issue, right? I mean, my daughters have different health needs than I have, right? My granddaughter has a different health journey than I will have. But I think that because of these advances, because of the White House initiative, because of the $12 billion that the president has asked for, because of a comprehensive women's health center, that didn't exist for me. And the fact that it now exists will change the trajectory of women everywhere. But we have to be mindful that many women live in places where there is no care, where there are maternal health deserts, where they can't get doctors. So while this is incredible for the women here, and there are virtual visits that are, in certain states they can have access to virtual visits, but we need to get women's health care into every state, into every country. This is a global issue. And we have to rectify the situation that this can't be an equity issue. This has to be something for all women.
Finally, here in Cleveland, we are very proud of anything that is local.
Yeah.
Of all of the hospitals and all of the hospital systems you could have picked to get involved with Alzheimer's and with women's health, why Cleveland Clinic?
Well, my friends Larry and Camille Ruvo were at the Cleveland Clinic in Las Vegas, and I had worked with them. They have the Ruvo Brain Health Center there in Vegas, and I had worked with them to put that up initially in that phase. And I wanted to start a women's Alzheimer's prevention center, and they were open to that idea. They said, we'll try that with you. We'll see if there's an audience for that. We'll, help you get that up off the ground. And they spoke to the Cleveland Clinic, powers that be in Cleveland, and we did a pilot study there to see would funders fund a women's Alzheimer's prevention center. Was there interest? Would women come? Would women support it? Would women who came be a part of research? And yes, 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 yes. And so my goal always was to prove that concept and to grow that into a larger women's comprehensive health center. So check, check, check.
Right.
And but also, certainly Cleveland Clinic is renowned around the world. It has a global footprint. This is a global issue. So many women live in poverty, live without access to care, whether it's brain health care, their bodies, and really trying to look at women comprehensively has always been my goal, because we couldn't understand why women are getting Alzheimer's unless we looked at women comprehensively. What is going on for women and in women at midlife? And that will change how we age. That will change how long we can work, how well we feel. It will change our emotional life, our mental health, our cognitive health, our physical health, and I believe actually our spiritual health. To feel seen, to feel cared for, to see your name on the door, so to speak, as a woman, I think it is a revolutionary change, and I'm really proud to be a part of it, and really grateful to the Cleveland Clinic for putting women's name on the door, and for understanding that this needed and needs a comprehensive approach. And I think all the doctors here are super excited. So many women have worked in this space for decades without seeing their name on the door, without feeling that women's health was valued. I hope medical schools will change how they approach women's health, that they'll spend more time thinking about women, educating new doctors about perimenopause and menopause and issues that disproportionately impact women, and how to treat them, how to talk to them. And I hope hospitals around the country and around the world change as well.
Well, it's so exciting.
Yeah.
You're setting the pace. We appreciate it. This is so exciting. I'm so excited to see what it does, and also
it's
learn
going to
more
do
as
a lot. It's already, I think, this is a beginning, but there's a lot has gone into this day. A lot of really looking at what exists, how best to treat women, what are the areas, that they need, whether it's sexual health, brain health, emotional health. People don't even think of brain health. Is that the same as mental health? Is that, why do we need brain health different from body health? All of these things, when I go around the country talking about it, people are like, I actually never thought about that. I didn't think about that, or I didn't think that, the medicine I'm taking wasn't tested on women, and therefore no wonder I might be having different reactions to it than my son or my partner or whatever. So I think that, this is a, kind of revolutionary way of looking, and yet it's so revolutionary to think that it's taken this long.
Right.
And so kind of, wow, really?
Yeah.
Yeah, but wow, really?
Yeah. Well, Maria, thank you so
Thank
much.
you.
We are so excited for this. Thank you for
Yeah.
taking the time.